Hey, it's Dr. Brink from Dublin Methodist Hospital, just giving you guys a virtual update here on the COVID-19. Just some common questions that are getting asked around, and hopefully we can give you guys some helpful tips and tricks to stay safe at home. So the first question is, what are we seeing at Dublin Methodist Hospital? Right now, our hospital censuses have been a little bit pretty low, and that's intentional. We're trying to keep anyone out of the hospital that we can, and so at this time, all elective surgeries have been postponed. And also in our office, we're trying to do as many e-visits as we can, trying to manage our patient population virtually if possible. In the coming days, I know we're going to also have some video visits that'll be available. And right now, basically what we're trying to do is just keep people out of the office if we can, and really trying to manage things as remotely as possible. The second question is, what are some common symptoms of COVID-19? Typically, I know everybody's probably heard this on TV and on the CDC website. Fevers, cough, shortness of breath, those are the pretty hallmark symptoms of these. I know most people, they said almost 99% of patients almost develop a fever at some point during the point of the disease. Some other common things that we're seeing too are just starting off with like a sore throat, maybe just some viral type symptoms, just runny nose, things like that. And then also a new symptom has kind of developed is loss of taste or smell. The loss of smell you may have heard is called anosmia. And then also some early signs could potentially be GI upset, including like nausea, vomiting, and even diarrhea can be some early signs and symptoms of this as well. Which kind of moves us to our next question here is, when do I want to know, should I get tested? Right now, because of a national supply shortage of COVID-19 test kits, we're recommending that most people just, if you do feel like you're sick, stay at home. We're reserving the testing for those that are really sick or have other, what we call comorbid conditions, things like diabetes, high blood pressure, and if you are over the age of 60. In order to get tested, you'd have to have a really high fever, worsening cough or worsening shortness of breath. And it requires a physician order. So if you do want to get, the question screens done to see if you do require testing, please call your physician's office. I know they can really help you answer some of those questions as well. Another question we're asking is, beyond social distancing and hand washing, what are some other things that you can do to keep yourself safe? I can't emphasize this enough. Is try to work on your mental health, try to get outside, get some exercise in. One of the big reasons why I wanted to film this outside was to say, you don't have to just stay indoors to practice social distancing. Feel free to join the Facebook group. Running is not canceled if you are a runner. You can still get outside and run and stay active. Working on making sure you're setting good sleep hygiene as well, going to bed at the same time every night and trying to wake up at the same time every morning. I know that can be very difficult this time of year, especially with what's going on with the COVID-19, is really setting those good sleep habits as well. And then in addition, I get a lot of patients asking me about, is the mail still safe? Or, if even like getting packages from the grocery store or packages in the mail. From what we've seen for right now, again, after you've handled any kind of package, whether it's mail or whether it's any kind of groceries, I think one of the more important things that you can do is wash your hands right immediately after you've touched that package. And that can minimize your risk. Everything that we're seeing, though, it appears that the virus can live on certain surfaces up to 72 hours, which will lead us to our next question here. So again, it just really comes back to just being vigilant about washing your hands and maintaining that social distancing. I know we talk a lot about droplet precautions. If someone who is infected coughs or sneezes, those droplets can be kind of spewed out into the air. And that's really where, it's important to maintain that social distancing. The next question is, how long does coronavirus stay on surfaces? A really good study came out and showed that even potentially up to 72 hours on things like plastic and metal. And even more recently, I'm sure some of you have seen online, they said that the coronavirus could potentially be viable on surfaces for up to 17 days that was seen on some cruise ships. So I think there's going to be more and more data that comes out on this. And again, this is why washing your hands is so vital, especially if you have gone to the grocery store, or you have handled packages from somebody else. Again, just really trying to work on your hand hygiene the best that you can, and making sure you're practicing social distancing. And if you do have some Clorox wipes at home, just plain old soap and water works really well as well. The way these viruses are kind of built, soap and water really can destroy the virus without, the bleach and all that other stuff, especially on your hands. So making sure you're doing a good job with hand hygiene. Just some final tips and tricks. And again, I know this is kind of a tricky time. If I can't tell you, if you got nothing else out of this little video podcast here, please just stay home. I mean, I think that's the biggest thing. We've been so fortunate, especially here in Ohio, that we've had some really great leaders leading the way and telling us, to stay at home, practice that social distancing, practice your hand hygiene as much as you can. I still think it's important to get outside. You can do walks around the neighborhood, take your pets out for walks if you can, but really, really just try to stay at home. I know it can be frustrating. Reach out to friends and family, get those board games out. There's a lot of really good things that you can do within the home setting as well. And so hopefully this will be the first of a couple series here. If you do have any questions, we can look into answering those down the road as well. But again, just wanted to thank you guys for having me, and keep up the great hand hygiene. We'll talk to you later.